Welcome to a breast health panel. I would now like to introduce Shalawn Facey. She's a certified lactation counselor here at One Brooklyn Health. So she knows all about the boobs in a slightly different way.
Yep. So yes, I've been a lactation counselor since 2012. And that pretty much means that I'm certified to counsel anyone who is choosing to feed their baby from their bodies. Anything from troubleshooting to any problems with breastfeeding, to any issues with their baby latching, or if they maybe have a baby in a NICU, and so they have to kind of get milk soon so they can feed their babies to sustain them and keep them healthy. Any of those things that falls under my purview. So I do that.
Okay. So many may be wondering,
yes,
how does this relate to breast cancer? So my question for you is, how can breastfeeding reduce my chances of getting breast cancer?
That's a great question. So lots of times people will say, oh, if you breastfeed, it will reduce your chances of breast cancer. But then we're like, well, how? And so we're not quite sure what the cause is, but there are two things particular that we know people who have a history of breastfeeding happens later in life. And one is the reduction of their exposure to ovulatory processes. Meaning, right, as women, we ovulate every month, we shed an egg,
yes,
and that process sometimes, the longer that happens, the higher our chances are of developing a cancer, right? So we know that when we're pregnant, our menstrual cycles, and also when we breastfeed, our menstrual cycles are paused. And so we're kind of pausing that period of time, and so that kind of reduces our lifetime exposure to having that hormone released, specifically estrogen, which we know is a big contributor to breast cancer, is having exposure to estrogen. So that is one of the reasons. The other thing is that when we breastfeed, we tend to shed some breast tissue.
Okay.
And so that we think also can be a reason why some people's chances are reduced.
Wow, that was very interesting. That was very interesting. I do have another question relating to that. How does someone stay breast aware when they're breastfeeding? So I know that when you're breastfeeding, you might also experience some type of tenderness, and which is also symptoms of breast cancer itself. So how do you stay breast aware in those situations?
So I think that's a great question. I think the biggest thing is to be breast aware prior to being pregnant, right? So if you are in the habit as a person who has breasts, if you're in a habit of checking your breasts regularly, knowing what they feel like, doing the self-check exams, once you get pregnant, then you kind of already know the normal lumps and bumps. Now, obviously, we know that when we start lactating, we might have some bumps, we might have some lumps, we might have some hard spots, which is very common. But if it's just related to breast, like maybe a clogged milk duct or engorgement, it should reduce or kind of move over time, right? So if we're breastfeeding and we feel those lumps and bumps and it's not moving, it's kind of staying there, it's not improving or going away, then we should definitely get it checked. And I think in general, whenever we're doing anything with our breasts, are concerned, breastfeeding or not, if anything seems abnormal or seems concerning, just go to your doctor.
So I think you kind of explained it. But can you get your regular mammograms while you're breastfeeding? Is that something that you should do or can do? You can do it, yes. The radiation that you would be exposed to is not enough that it'll affect your breast milk at all, so you definitely can get a mammogram if you're breastfeeding. The recommendation is that you go to a mammographer who is familiar with dealing with a lactating breast, that knows that you are lactating, that you do have milk, that you are breastfeeding. And then you get your mammogram, and the recommendation is to empty your breast as much as possible prior to getting the mammogram. So right before the mammogram, either pump as much as you can out of your breast or have your baby there and have your baby nurse right before getting your mammogram. And then you can get your mammogram. Okay, wow. I learned a lot today. Yes. I don't have kids, so I've never breastfed before, but I'm definitely going to keep this with me for a lifetime. So I thank you so much,
You're
Shalawn.
welcome.
Thank you so much for being here with us today.
My pleasure.
Thank you, everyone, for coming out to a breast health panel. For more information, visit www.onebrooklynhealth.org.